Hello, 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 1, 2, 3, hello, mic test, hello, 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 hello. ठीक है।
TMJ pain, so how it starts and aggravates, all those things we'll be looking at. Hello, hello, am I audible? Yeah. So basically there are two methods to analyze your TMJ. What is that? One is in front of the patient using your index finger, and another one is using a little finger and going into the internal acoustic meatus. So okay, so please remove your mask. Remove your mask. Okay, there is one which causes habitual TMJ problem, and one is even the skeletal problem. So it can start from skeletal anomalies also. So always you make sure you palpate both the side TMJ with your index finger starting from tragus. So tragal pointer is a main thing what you can appreciate more, and you hold your index finger, ask them to open and close. Open, open. So as I can see, if everybody can notice how she is trying to open is her left side jaw is deviating. So okay, open karo up. So whenever she is trying to open, the jaw is deviating onto the left side. Fine. ये head end भी थोड़ा मुझे पीछे चाहिए, so she can just lie down. Okay. I don't. Is it fine now? Okay. I'll take back. So everybody you can visualize now. Fine. Okay. Another method is go intratracheus and ask for opening. Open, please. So here I cannot make out much of the changes because she is trying to open very little now, because we have already made her apprehensive that she is opening on one side. She is already got used to the trick that she is opening only this much. So we cannot palpate anything onto the left hand side now. Open karo, bada. So here we can just make out that it is getting deviated, and from the fossa, temporal fossa, the temporomandibular joint is sliding away. So that is what is happening. But the pull of the lateral pterygoid and the medial pterygoid with the pterygoid fovea attachment of the lateral pterygoid, it is pulling in and it is derotating. So once the articular eminence it is reaching, the capsular part is coming out and the TM joint is coming out. Light off karna hai. Okay. So that is one thing, and for this we can use direct photobiomodulation, intraorally, extraorally, both the things. Okay. For that we will use a TMJ tip. This is cutting, he has kept it for. Yes, ma'am. If we can get that tip only directly, that black color tip. 3 mm, that should be fine. 8 mm we can use, but hardly the penetration will be less. So basically we are trying to reduce the intensity of pain while she is opening. Within a fraction of seconds after this therapy, she will be relieved. Weekly once for at least 6 weeks. So depends on each quality treatment sessions. Every session has to be followed up in regular interval. Yes, Chandrasekhar sir will be taking it. Calculate how many sittings, how many wavelength. What wavelength is same thing like dual. Duals you have to use it. Yes, in TMJ. permanent solution can't be made without oral surgeon because we have to cut off the articular eminence and then leave it for it. Yes, it can recur. Thank you. Basically, this won't fit to remove everything. We have another set where I'm just going to show you now with this because this won't fit now for this laser machine. So only for therapy or relaxation of the muscle or TMJ. You can just see TMJ 0.6 watt. It is already set. Treatment time 600 seconds. That is almost 10 minutes. Energy is 180 in for total joules. Very simple, sir. Everything is programmed. Nothing much for a brain work. No, that is activation. But I'm trying something else because this tip is little more to reduce what wattage. That is 0.6. Yeah, manage we can 980. So this peak hour 0.4 I made it. The only thing is this should work. We are not used to this. इसका नहीं है ना वो हमारा पूरा सेटअप चेंज करना पड़ेगा इसमें ये जाएगा लेकिन फिर से मुझे पकड़ना पड़ेगा उसको So basically what sir told 3 points. One is extraoral, one is intraoral and pulling in transverse direction. Just you can hold it. So where does this fossa present? When she starts opening. So what I do as a oral surgeon, we do give local anesthesia into the fossa for some time and then do this PBM sessions after 1 week. But right now only PBM will help her in all these conditions. Open. You can see this depression, all of you. So this is the condylar fossa wherein you have to give the laser. And once this is done, you can go intraorally and same spot. Like if the condylar head is like this, coronoid is this, you have to hit the condylar neck from intraoral surface, that too in this direction. This has to activate. The pterygomandibular raphe, you have to follow that and go on to the top. Okay. The thing is, I'll change that laser machine. If he comes here, I'll just change this machine and then I can give a demo. Yeah, machine change करने बोल दो मामा. वो dual लेने बोल. It can be continued. It doesn't harm anything until and unless patient wants it to get harmed, because this is very low level and they can take it in a day, twice, thrice, 4 times, no problem. TMJ pain is like suicidal tendencies are more. Anybody heard an article regarding that? Because patient won't be having that pain until and unless they feel it. Once they start feeling it, either it is from a nerve or the TM joint, they doesn't know in a proper way. Nerve pains, neuropathic pains can be managed, but TMJ, that clicking sounds, that has to go again programmed. Oral medicine people will be knowing more about programming nowadays. In the ganglion, even we have photobiomodulation therapy for that neuron ganglions also in TMJ, TN. Same, it works. Basically, it is in the middle cranial fossa, where in the trigeminal cave, it is facing upward, Meckel's cave. So 3 branches, again a semilunar ganglion and trigeminal ganglion. One goes maxillary, one comes mandibular, one is ophthalmic, all those things. Penetrate, it is made to penetrate. Longer duration of time. Yes, other things not. मुझे बस ये टिप लगा के दे दो इसमें, ये इसको ये कनेक्ट नहीं होता है तेरा. इसका वो और एक अरे था ना, ये इसको भी नहीं कनेक्ट होगा. That's what I got it now. No less gold. Because this is totally tipped and he's like, ನೀವು ತೋರ್ಸೋರಿದ್ರ ಬರ್ರಿ, ಇಲ್ರಿ TMJ ಐತ್ರಿ ಬರ್ರಿ, ಅದ್ರ ಟಿಪ್ ಇದಕ್ಕೆ ಅಡಾಪ್ಟ್ ಆಗ್ತೈತೆ ಅಷ್ಟೇ ರೀ. Only left side she has clicking sound is there. Whenever winter comes, she'll have more. ఇక్కడ
Can we keep the clicking sound?
close pain. Okay, so it usually occurs in the morning or सुबह शाम या खाते वक्त. अच्छा 300 plus sign plus. Oh, this is not. Konang. So first locate the TMJ exactly where the point is. Nukuli, open the mouth. Yes, leave it. Okay. No, get it little closer. You will not feel any cold. You will not feel any hot. This you will not feel anything. You just this is light. See, this is that's all you. No invasive procedures. No invasive procedures. So whenever you're treating a TMJ lesion, no, do it in a pecking motion like this. Can you slightly turn your head like this? Yeah. Can you see the range of motion like this? It has been set for 60 seconds. You can either do it continuously for 60 seconds, wait for 1 minute, let the tissues absorb the energy. Again, after 1 minute, again you can repeat the procedure. Slightly open your mouth. Open. Yeah. Close. Yes. Start. In case of hypersensitivity or in case of TMJ pain or any pain, no, patient will tell you immediately that the pain has been reduced. So I tried putting ice cubes in the patient months after treating the case of hypersensitivity also. You can use either any of the varnish or MI varnish, isolate the teeth, then rub it vigorously for a minute, and then you use this laser. Then put ice cubes in the patient's mouth. Patient will not feel anything that much effective how the laser is. Yes. No, initially, unless and until you gain the confidence, what you can do, you can take cold water in a syringe and press it and ask the patient, is there any sensitive feeling? So slowly you will gain the confidence. TMJ या डेंटल हाइपरसेंसिटिविटी TMJ एक सिटिंग में आप 3 बार कर सकते हैं. Depends upon the severity of the lesion TMJ और what is the etiology of TMJ. आराम हो जाएगा बिल्कुल बिल्कुल. हाँ, तो आप एक्सपेक्ट कर सकते हो 2-3 सिटिंग के बाद पेशेंट को 15 दिन बिल्कुल पेन नहीं आएगा. I am waiting for 1 minute and again I will repeat the procedure. The reason for rotating like this to deliver the energy of the laser deeper into the tissues. So if I do it like this, the TMJ is not a pinpoint location like this. It is a larger area. So I will be doing it like this. Start. Laser. You can use rather than using spirit because anything अभी आप लेजर कर रहे हो तो स्पिरिट यूज करते हो दैट इज इन्फ्लेमेबल ये लग सकता है. सो बेटर टू यूज बेटाडीन और सलाइन. या इट कैन यूज कोल्ड स्टरलाइजेशन. कर सकते हो नो प्रॉब्लम. एंड लेजर टिप्स एक्चुअली दे आर सेल्फ स्टरलाइजिंग. So if you do to this 2 to 3 minutes, no, the patient will, the patient is from here. She's a student. So you can take her number and get the feedback how she's feeling after the 1 week or after 3 days, something like that. If you feel that you are getting a relief, you can call ma'am and tell her exactly, so that they will get a first hands-on experience के कितना effective हो सकता है वो. तो आपका ट्रीटमेंट हो गया, नो इन्वेजिव नहीं है, ठीक है. अभी आप मैडम का नंबर ले लो और उनको बताओ 2-3 दिन के बाद कि आपको कितना इफेक्ट, कितना परसेंटेज रिलीफ मिला है और कितना दिनों तक मिला है, ठीक है. Usually in winter when you yawn too much, no, there may be little pressure. Okay. Yes. Why? Yeah, she's not eating because of TMJ or it's the junk food that she's not eating. You can go.
Just gloves, you can wear gloves and you can see, palpate. So what we can do is, we can start him on colchicine tablet. You can take a glove. So this is all vertical bands where you can feel and see this circumoral bands. All lip is also involved. You can see this, like here, totally from the part, it blanches everywhere wherever there are fibrous bands. Even if you pull it, that blanching can be felt. Okay. So it depends on the grade, how much he opens. 2 finger width is there, almost 30 millimeters we can go ahead with. So basically we start with photobiomodulation therapy, 2 sessions of, yes please, go ahead. Camera. खाली नीचे देख, नीचे देखिए, नीचे देखिए, नीचे देखिए. हाँ, this is fine. Stop it. These are the bands wherein you can feel more. Okay, go deeper, go deeper. You can feel how hard they are here also. Okay. Ma'am, Kennecott है? Kennecott, Highlandase. Triamcinolone, hyaluronidase, 1500 international units. Okay. So basically I'll tell the protocol. You can start with the injections later. So whenever we start, we just give 2 sittings of photobiomodulation. So that is 2 days apart. After that, we will call every week for 6 weeks. So tablet colchicine can be started OD dose for 3 months, but it has its own side effects of gout and all those renal toxicity, all those things. So any medically compromised patients first have to be checked for those things, because the colchicine tablet can cause the acute gout syndrome. That was used for gout actually. Now that can cause a renal toxicity. So colchicine is not advisable in all the procedures. First we'll start with steroid and hyaluronidase. That is hyaluronidase, 1500 international units. So that will be mixed together, and local anesthesia is used as an vehicle. So we can use 2 ml of local anesthesia, 2 ml of steroid and hyaluronidase. That will be in a powder form. So when we mix all these things, we can start injecting on those fibrous bands. That's it. So that is the treatment protocol that has to be repeated every week for 6 weeks. So 6 weeks later, again you can go ahead with evaluation, patient's mouth opening. How do you check for patient's mouth opening? Between the intra-incisal, because his incisors are already worn out, either you can take lips as a markers. So lip or mouth opening can be taken. If there are no teeth, then you can use the ridge, alveolar ridge also, to mark the distance or mouth opening. Okay. Yeah. 2 ml steroid means 4 mg per ml will be there in a Kennecott. If that vial is there, I could have shown you. Yeah. Yes, with 2 ml of local anesthesia. Mix in the same syringe, and hyaluronidase powder will be there. So that powder has to become a liquid. So what you can use is local anesthesia, inject into that hyaluronidase vial, make it a solution, and then withdraw all the things, 4 ml. Entire 4 ml. Fibrous bands bilaterally. So that is 1 dose. Single dose. Not unilateral. Much of, yes, 2 ml. After doing PBM, for 2 sessions of PBM finished, after that you can start injecting. every week once for 6 weeks continuously. If patient is diabetic, you have to check his diabetic status because steroid can give rise to higher steroid sugar levels. This is 40 milligrams. This is 40 milligrams of triamcinolone we are giving. If you are giving dexamethasone, there won't be any problem. But if you are giving a triamcinolone, that can cause some problems. Yes, ma'am. Not Hynidase. Kenacort. Triamcinolone 0.1 ml. Yes. Every week you have to continue, no? 6. After 2 sessions, that 2 alternate days you can give the PBM and then you can start with. So basically in OSMF what happens is patient is unable to open wide. He will be having burning sensation, that is one. And one more thing is whenever he tries to eat anything, there will be dysphagia in the posterior phalanx if it is involved. So that feeling only can make it more transparent for him. So these things have to be, these fibers have to get softened. So how you soften them? By using the intralesional injections and laser in coherence. And after 6 weeks of all this therapy, what you can do is take our laser tips and start cutting those vertical bands one by one. Analyze them. Bands. Do the fine, ma'am. Yes, ma'am. They won't allow it. It is not about oral surgery or anything. Yes. Always you can. But these OSMF patients will come for 3 weeks. After that, they will be lost. That is the problem. Every 6 weeks, if you keep them followed up, and one time payment should be made. So then they will return. If you ask them to pay every interval, then again they will be missing. Give them a package of whole 6 intervals at a stretch and keep injections ready with yourself. Don't ask them to get it. They will not get it. Kenacort will cost you around 120 to 130 rupees per the vial, and Hynidase around 100. Maybe I don't think so. Yes, ma'am. You can sit there. அவங்க பென் தரக் here. or basically most of the patients, even after starting the treatment, they will not bear a habit. So first is habit cessation. For that, you have to literally fall behind them. So until and then the treatment won't work, and again they'll come with the same mouth opening. अभी इंजेक्शंस दे रहे हैं हम, आप कितने दिन हो गए छोड़ के? सुपारी खाना, तंबाकू खाना 2 महीना हो गया, अभी एक बार भी नहीं खाया 2 महीने में. अभी छोड़ना है या कंटिन्यूसली चालू रखना है? छोड़ दिए है ना, तो फिर ठीक है. अभी छोड़ देने का और हफ्ते में एक बार इधर आने का. मैडम जो भी रहेंगे वो आपको इंजेक्शन देंगे इधर, और जितना इंजेक्शन होने के बाद कितना चेंजेस होता है आपके मुंह के खोलने में वो भी देखेंगे हम. एवरी टाइम आपको फोटो लेके दिखाएंगे. नहीं, हफ्ते में आना पड़ेगा क्योंकि 15 दिन बहुत लंबा हो जाता है टाइम. तो जितना चेंजेस होता है वो वैसे ही चेंजेस रहने के लिए हमें हफ्ते में एक बार देना पड़ता है वो. ठीक है. कहाँ पे रहते हैं, कितने दूर है, कितना? हाँ, नहीं मुझे यहाँ का नहीं पता है. कितने किलोमीटर आपको? 4 किलोमीटर है ना, 10 मिनट में तो पहुंच जाओगे. भागते आओगे तो भी पहुंच जाओगे, है ना. ऑटो से आना होगा. मैम some injections they are getting, Hynidase and the Kenacort first, followed. We can do that, but only the tip is, yes. Tip. No, this only I'll start off. ग्लव्स का एक फिंगर काट दो. इंडियन जुगाड़. ग्लव्स का फिंगर काट दो. एवरीथिंग इज लॉस्ट. So I'm just starting the laser. So 810 nanometers, 100 milliwatt. So once that laser on is there, you can just feel this. So just you keep it on and keep on rotating motion. Yes, yes. In touch mode, basically. So even while giving any of the local anesthesia, we can do this. So sensation of the prick also will be less. Pain-free injection. Just on it, no? Yeah, started. Yeah. So just roll it over all the things. Yes, along the bands, because we are going to inject in those bands, because those bands have to get disintegrated within. And until and unless those posterior vertical bands doesn't disintegrate, mouth opening will not increase. Along the bands, vertically, because there are no horizontal bands here. Only vertical bands are there, ma'am. 1, 2, 3 points. Or else even all around we can just pulling it up. So one session is both the sides. Again, if you want to wait for 1 minute, again wait for 1 minute, and again you can do the PBM for a second. Yes, it can be on the other side. Save time bands so that your injections, wherever you are going to put the injection, should not pain. Basically, yes, along the line. Hmm. Go for 300 watt. No, no, no. Just touch, touch. Yeah, yeah. Just touch the surface. I'm just pulling it out so that I can see all the bands. Just touch and go. Hmm? So there is one curcumin spray also available in the market. Curcumin, like that is a spray which can be sprayed all along. The burning sensation in the previous session will be less. Hmm. Yes, that is one, and even PBM therapy helps in disintegrating those fibers as the energy ATP. That's what I told in the lecture also, that whatever cell death has happened there, a disintegration has taken place, fibrosis, it disintegrates that fibers more. Yes, that injection is a advantage adjunct to this treatment. So two settings of PBM like this, that should be fine. यहाँ पे ओरल मेडिसिन में कौन है अभी पोस्टेड? यहाँ पे प्रोटोकॉल अभी व्हाट यू फॉलो फॉर ओएसएमएफ? यस मैम. ओके. curcumin spray. Okay. or surgical excision? Surgery. Have you used collagen membrane in surgical interventions? Only buccal pad, just pulled it in. Buccal pad. Okay. Injections. Okay, we will finish. आ जाए तो ठीक है, नहीं तो आप करते हो तो इंट्रालेशनल कभी भी आप कर सकते हो, नो इश्यूज. We'll shift the patient here, sir. This is done. और हफ्ते में एक बार जब आओगे ना, अभी 2 सेशन तो लेजर के हो गए, अब कभी भी आ जाओ, कर देंगे. माइक.
Okay. No need at all. कहाँ पे छाले है आपके मुंह में? जीभ पे है? Side. All the parts. Diabetic since 14 years, hyperthyroid since 15 years. HbA1c. She needs multiple sessions of PBM and PDT as well. Yeah. Sorry. So whatever the medical intervention they are having, medicines. Any vitamins have they prescribed? A to Z C. If you want, you can get additional vitamin D and vitamin B12 levels. Get it checked. If they're deficient, you need to meet one general physician and get that also in control. So that will lead to a series of cascade of what are the problems she is having. So that will help. And what are the medicinal supplementation she is using? Let her continue that. Over that, what we can do is, Amit, so rather than doing it on goat mandible, this is the ideal case for oral burning mouth symptoms. She is giving symptoms of ulcers on the buccal mucosa as well as on the tongue, and it's burning. So let's give a demonstration of photodynamic therapy on this patient also. Huh? Dye, Amit. Yes. Okay. Ah. Yes, since 15 years, what is? Yeah, I got to see the reports of that. So whatever the medicine she is taking, later continue that. I am not doing anything invasive. Just I will be doing the photodynamic therapy, which will only help her in alleviating the burning pain. Yeah. And if possible, if you can do it every week once, it will be helpful to the patient. Can you get one syringe? So this is 660 nanometer. We are not using this because we are using Indocyan green dye. It's always 810 nanometer. We have to use it. We have used this in medical college where they had given an opinion that diabetic foot that can't be cured and it has to be go for plastic surgery. No, only the lesion. So we use this on the diabetic foot ulcers, and we have used the Yoshimura's proximal principle. Yoshimura's proximal principle says that if the ulcer is this big, so if you concentrate your lasers on the center where no vascularity is there, nothing is there, it is not going to act. Yoshimura's proximal principle is where the vessels are there in the proximal of the lesion. You have to start your laser therapy with the proximal surface of whatever the lesion is, and then slowly come towards the center. So whenever, rather than our first glance will be that जहाँ पे अल्सर दिख रहा है वहीं पे टारगेट करो, वैसा नहीं है. जो प्रॉक्सिमल एरिया जहाँ पे वेसल्स है वहां से आपको रीजनरेशन करना है. तो यू हैव टू अप्लाई द वोशिमोरिस प्रॉक्सिमल प्रिंसिपल व्हेनेवर यू आर सीइंग इट बिगर अल्सर और एनी लीजन. No, whatever, whenever you speak of joules, it is only related to square centimeter. So if the lesion is more, what I usually prefer to do is to take a prism and then scan it slowly everywhere. Rather than keeping it point to point, I'll scan it. And always believe that some sort of laser therapy is always better than nothing. So even if you're short of time, rather than doing it for 8 minutes or 10 minutes, you have completed in 5 minutes. But still you are delivering some energy to the tissues, right? So there is going to benefit only. That is called Earnshaws law. ARNDTZ, Earnshaws, SHULTZ, Earnshaws law. That is called also called as a biphasic dose response, where if it is between 5 to 8 minutes, right? So even if you are using it for 5 minutes to 8 minutes, it will work. It doesn't mean that you are less short of energy, it is not going to work. But you don't overdo it, because the Earnshaws law says that too much of laser therapy is not going to give you any results. It is not going to give positive results or negative results, no results. So whenever be in that biphasic dose response of 5 to 8 minutes or whatever the region, whatever you specified, don't overdo it in the इंटेंट दैट मैं अभी 1 घंटा करूंगा तो ये जल्दी नो नथिंग लाइक दैट. You have to start delivering the energy slowly. You have to make the cells, prime those cells for energy, and then only we have some cotton. Cotton. I will try like this. No, I need a needle. It's too. Yeah, needle. Put the rotate ಮಾಡ್ರಿ. ಇಲ್ಲ rotate ಮಾಡ್ಕೊಡ್ರಿ. ಇದು ಇಟ್ಟಿರಿ. You can use this in pockets. You can use this any lesion, any bacterial, viral, fungal. You can use it wherever there is infection. Always the dye will be useful. Wherever there is injury or ulcers, no need of dye. You can heal that with photobiomodulation therapy. No cotton. ये सिर्फ जबान के ऊपर लगाऊंगा, इंजेक्शन नहीं करूंगा, ठीक है, डरिए मत. हाँ, सिर्फ जैसे जबान आप लगाए उसके ऊपर डालूंगा. इसे देखता हूं मैं. माउथ मिरर. है ना यहाँ पे. मैं माउथ मिरर से देखूंगा. इस तरह देखिए जी. कैन यू सी दिस अल्सर्स रीजन्स. जबान पे भी आपको लगता है. So anyone can put the timer for 4 minutes. जी इसके ऊपर इंजेक्शन नहीं देंगे, सिर्फ इसके ऊपर ऐसे लगा देता हूँ. हाँ बस ये देखिए ऊपर से करवाता हूँ. हाँ, आप डरिए मत, मैं झूठ नहीं बोल रहा हूँ. नो आफ्टर इंजेक्टिंग ऊपर ही लगा रहा हूँ, ठीक है. That's one disadvantage. इस तरह देखिए No, get the patient into confidence, saying that what you are doing. See in the initial. Now she's quite okay, right? This will cost around 2000 rupees. I'm okay. No, not all patients are that fortunate to upper side G palate. The problem with this is retention on the palate. But at least let us. Hmm. What we can do in this, no, in palate, we can take any cotton, patch it there, and then deposit and let the it wait for 4 minutes. Some sort of retention or gauze piece, gauze you know, you put it and then. Okay, see the patient is now telling where all to put, right? That means you gain the confidence of the patient. Some of madam is there. जी नहीं रख दीजिए मैं कर रहा हूँ जी हाँ जी सी कैन यू सी नाउ हाउ द पेशेंट इज कोऑपरेटिंग so I started with 4 minutes, right? So by the time I Jaban but so by the time you tell me the 4 minutes is completed, so, okay, so यहाँ पे 4 मिनट्स का अगर होगा तो यहाँ बाकी का मैं जब यहाँ तक आ जाऊंगा तो 4 मिनट्स वहां पे भी हो जाएंगे. एग्जैक्टली करेक्ट. Tell me once it is 4 minutes is over, then I will start. 8 seconds. So whenever you are in PDT, yeah. और एक फिंगर चाहिए. नहीं वो जो ग्लव्स टूटा तो कहाँ है वो निकल गए क्या? अच्छा ठीक है चलेगा नो प्रॉब्लम. डिस्कार्ड कर दिया शायद उसको. Four minutes over. So I will keep it in 200, 300 milliwatts PDT. As I always said, it is always 300. जी बार कीजिए माँ जी. PDT and pain inhibition exactly. Don't confuse with the pain inhibition of photobiomodulation with photodynamic therapy 300, right? So for yes. नहीं जब भी इन्फेक्शन है तो आपको डाई यूज करना है इतना याद रख लीजिए. ठीक है. 2 factors are there. I can say 1 factor is there. Whenever there is a high aesthetic patient or a high profile patient, always go for Indosin green. Why? Because the biological effect will be same. The only problem with methylene blue is it stains for a longer period of time. Die. Pocket is infection is there. So die. Start. Put the start. On the start button. So one more alternately what I could have done is taken the prism and Stop it. So this is a larger lesion, right? Now what I can do is I can remove this. Where is the box? Amit? Amit is not there. Amit. Okay, I will start with this only. I have the privilege to do it for here. Time is there. This is 60 seconds. Now 120, 130, 60, 120. So I can directly do it for 120 seconds. जी मैं सब जगह करूंगा आपको वो वोट के ऊपर बोल रहे हैं आप जी हाँ कीजिए जबन पहले जीप खत्म कर देता हूँ फिर बाकी जगह आता हूँ मिली बैट हाँ what leisure you have in the clinic okay no if you rely on the science of pleasures no how many wait one okay okay and that's why I'm now and keep it carefully on it now Now you can. So suppose now I'm using 300 watts, right? I will multiply this by 4 times. 1200 or 1100, because it is not exactly 4 times, it is 3.6, 3.7 approximately. So the 1 watt you can keep. So don't think now that when you are crossing the 1 watt you are into thermal zone, because the energy what you are using is 300, 300, 300, 300. Again still you are in the photobiomodulation zone only. One watt, 1000 milliwatts is 1 watt, right? For PBM, I need not have to use the laser safety protocol, right? Because it is very extremely low level photobiomodulation. Whenever you are speaking in scientific literature from hence onward, don't say that it is a low level laser therapy. Always say you are doing a photobiomodulation. See, the whole lips is covered in one sitting now in 60 seconds. Instead of going with that 8 mm, if the lesion is larger, go with the multiplication of 3.5 to 4. Much better. So tomorrow again I will be speaking on Oshimura's proximal principle and Earnshall's law. These are very, very important. Definitely. That's why what I told you, no. Once you start knowing the science of laser, you need not have to write down the protocol for lasers. Exactly. Exactly. Pictures. Yeah, definitely. Because if it is helping the patient, why shouldn't I? If I am helping one soul to alleviate his pain or her pain, you're doing a social job which gives more satisfaction than whatever the amount the patient pays. Because when I started my laser dentistry into the journey, I started treating them for free. First I gained Mugoli. ज्यादा चुभ रहा है तो मुझे बता दीजिए. हाँ, नहीं चुभेगा, फिर भी अगर आपको दर्द हो रहा है, चुभ रहा है तो मुझे बता दीजिए. When I started my journey into the world of laser dentistry, first I 10 to 15 patients in different clinics I started free. So when the local dentists got their confidence कि हाँ इससे कुछ हो रहा है, then they started calling me. I didn't charge anything for the 10-15 patients. First gain their confidence. More than that, first gain your confidence. Once you start coming to know that this science really helps, then your way of convincing the patients also changes. Because now you know the laser science works. Otherwise, to a blind or illiterate person standing there or they don't know anything about the laser, ये क्या कर रहे हैं सर, एक लाइट छोड़ के क्या कर रहे हैं? That will be their first opinion. So slowly when you start reading the articles, gaining some knowledge, systemic review articles, you'll come to the wonderful world of laser dentistry or laser science, laser therapy. इस तरह देखिए मेरे तरफ जी. Immediately, nothing. After 24 to 48 hours, she may tell you. This is a long-standing case of 15 years of hypertension and all those. We can't expect in one exposure or two exposure. At least 4 to 6 weeks has to elapse to get a proper response from the patient. And this is a chronic case weekly twice or every alternative day. The patient is nearby to your clinic every alternative day, or if the patient is far, at least twice a week. Otherwise, if the patient can't come, give them that MIC device which I shown you. Let them use it at their home. At least some sort of, without that also they can use it. Blue, red, combination of blue, red. आपने नहीं देखा? हाँ, वो पेशेंट को होम केयर के लिए दे दो. Exactly. That is applicable to dentist also. Augment the some sort of laser light is always better than nothing, right? So this is a superficial lesion which has got systemic effects. So you just can't rely on lasers and say that it is not. Whatever the pharmaceutical intervention has to be taken care of, whatever the psychological patients they are undergoing has to be taken care of. This will alleviate the pain for sure. This will reduce the pain for sure, but it is not going to give complete 100%. I charge them for that before only. This is written, once you return the machine will return this. So now in जी कर रहा हूँ वहाँ पे भी. So why I am taking it to 1300 is palate I am not able to contact it. So I will be as close to the patients but delivering little more energy so that whatever I am thinking, I want the energy that will be delivered. It is in non-contact mode. Most of the time don't do any PBM without contact mode. With every centimeter of distance, you are going to lose 33% of energy. That's what the science says. What? Any questions? Still, see, this is a laser science. Is a science like any other branch of dentistry. Laser is entirely different branch. It can't only be said no. It is a perio because of the lesions and whatever I have told you, photobiomodulation, photodynamic. It is a vast science. You will slowly gain. The only advantage with laser science is there are very less side effects, no side effects, and there is the learning curve is not that steep as you are thinking that it so much of laser science is there. You start experimenting, you will gain experience, you will definitely make it. That I will make it clear tomorrow. I will make it for sure because till afternoon I didn't know who my target audience was. Now I came to know that there are general dentists and there are interns. So I have to think like an intern and then make it that simple for them. So I will be sitting again for 1 hour today to make it as simple as possible for the interns and then try to make some sense of laser dentistry. Exactly. We have to. Why the patient will visit you, why the patient will have more footfall in your clinic when you are doing the same procedure what they are doing. You have to prove yourselves you are doing something different, one step ahead, and without any side effects, without any steep learning curve like that of implantology. You have to see the bone quality, quantity, which laser implant you are using, what is the systemic conditions, how much distance you have to maintain with the teeth and implant, all those. That's the learning curve. You can directly start with day one also. The only thing that is stopping from you is you yourself. Exactly. That's what you don't believe that 8 mm tip you take it in your hand with the red tip with the red. When I started my laser dentistry practice, I didn't knew that this tip has to be removed to do. I use this with the thinking that it is working. Then slowly, that's how I started my laser journey. Do you think that I was a pro from the day one? No. first patient, then times 4 years, 4+ years. That no count. Exactly. That's what I told them, that choose your mentors. If you think that this laser was not working or it is substandard, why as a professor and HOD would get a bad name to myself, right? Because if I sell it to my friends, suppose, and if it is not working, will they keep quiet? कॉलर पकड़ेंगे मेरा, साले क्या दिया है इस चीज को. नेगेटिव फीडबैक सी, मशीन आपका मोबाइल अभी है, नया नया टीवी है, कब खराब होगा आप बता सकते हैं? नहीं बता सकते. लेकिन सर्विस कैसे मिल रहा है उसके ऊपर आप बोल सकते कि इसने अच्छा सर्विस दिया, मुझसे ज्यादा चार्जेस नहीं किया, और जो भी है ईमानदारी से किया. दैट गारंटी वी गिव टू एवरी कस्टमर that within 8 working days that laser will be again back on your table in good working conditions. That much faith you have to have. So anything can happen to any machine, not only laser, right?
But what is a not reliable? What will be reliable machine?
They don't ask for guarantee in heart patients. अब bypass हो गया, अब डॉक्टर आपको पूछो कि आप गारंटी क्या दोगे कि ये पेशेंट अभी बाईपास के बाद 10 साल 20 साल जिएगा बोल के. When it comes to dentistry, people are choosy. That's my nature also. That not only this by human nature. When it comes to dentistry, they will start asking for guarantees and warranties. जी, अभी give the water to her for. Some ulcers which have got a very erythematous zone to that, which is very extremely painful. Can I have your ears intense, please? If you come across any patient which has got a very erythematous zone which is extremely painful, some patients have that. So what I usually do, I use a lignocaine or 300 milliwatts of laser and numb those erythematous zone. Then I will take a 400 micron fiber and then just scrap that erythematous borders. That one moment it will be painful, but tell the patient to come back on the next day and give his response. बोलते सर पेन तो बिल्कुल चला गया है, मैं खा रहा हूँ पी रहा हूँ, अभी वो जो पेन था अल्सर का बिल्कुल नहीं है. इफ इट डजंट टेल दैट, यू कम एंड आस्क दैट सर आपने ऐसे बोला था और पेशेंट ने ऐसे नहीं बोला. एग्जैक्टली. नो सर आई एम डन. यस. हाँ, आप पानी से कुला कीजिए. वाटर इज नॉट कमिंग. ಸರ್ ಸ್ವಲ್ಪ ನೀರು ತರಿಸ್ತೀರಾ ಮಂಜುನಾಥ್ ಸರ್? ಸ್ವಲ್ಪ ಯಾರಿಗಾದ್ರೂ ಹೇಳಿ ವಾಟರ್ ಇದು ಮಾಡಿ. ಇಲ್ಲಿ जी आराम से ಮಾಡಿ. यहाँ से आपको पानी लेके थूकना है वहां पे. यहाँ पे थूक दीजिए. यहाँ पे क्या हेल्प द पेशेंट. Who is there? Close this recording.